everyone. Welcome to the SavvyCast. This is Jamie, and I'm so grateful that you're here, whether you're listening to the podcast or watching on YouTube. Thank you for tuning in. Last week's episode was with Dr. David Sender, a resident at the Auburn University Veterinary School of Medicine. He walked alongside us with our journey with Cam. And last week's episode was an hour on the topic of euthanasia. And he shared from his perspective as a veterinarian. And he talked about not only our journey, but that many of you have faced or will face if you have a pet. I highly recommend that episode. I've already received feedback from many who found it helpful and encouraging. So do check out part 1 with Dr. David Sender. Today, you will hear or watch part 2. And basically, we asked Dr. Sender questions about dogs. My Instagram and podcast followers submitted questions, and they range from everything from what is the best dog food to should dogs take supplements? Is it safe to kiss your dog? And is it better to have one dog or two? We cover the gamut. So stay tuned for part 2 with Dr. David Sender. I have lots of questions about dogs.
All right, let's do it.
Okay, let me start with a few that are just miscellaneous. And I actually did a blog post once, and it had a picture of me kissing Cam, and it was talking about, can you kiss your dog? And in my research, there are 2 camps. One is
for sure.
no, and one is yes. So I did see that some medical professionals said that bacteria could be transmitted or so forth. What's your opinion on kissing a dog in the mouth or on the snout?
Yeah, the medical opinion that I have to share with you is absolutely, just like with any other contaminated area, there are definitely things that can be transmitted, and there are what we call zoonotic diseases. So diseases that can be transmitted from animals to people. So different parasites and things like that can be transmitted, technically speaking. There are other infections and things like that we worry about as well that sometimes can be transmitted that way. All of that being said, that's the medical side of things. Is yes, I have to tell you that if you kiss your dogs or if you share any bodily fluids with them at all, then
you can get
yes,
sick.
You are at risk for getting infection. At the same time, do I kiss my dogs? Absolutely.
Yeah,
My little terrier
right.
loves to lick my face all the time. She likes to lay on top of me and lick my face. So we also have to keep in mind that dogs don't wash their hands. They don't brush their teeth unless we brush them for them. And they still lick dirty things outside. So keep that in mind and use that however it is that fits you. Personally, I'm not really much of a germaphobe. So that doesn't really bother me very much. But I definitely know plenty of people that do not allow their, dog to do anything around their face. But my personality, I love to be just kind of like up and involved in whatever with my animals. So I don't have a problem with it personally.
Yeah, I think everyone has to make their own call. But I feel like on the list of things I might die from, an infection from my dog is way down there. That and eating farm-raised fish that some people get so concerned about. Oh, that's another topic. Okay. Now, this is one that when I saw this, I thought, this is a great one. Reverse sneezing. That is the worst sound. That's one reason that I landed in the emergency room here before I brought Cam to Auburn, because he was doing the reverse sneezing on top of having a nosebleed. So can you address, though, in general terms, and then are there any times that that's not a good thing?
So reverse sneezing, and I don't mean for this to sound overly simplistic, but it is exactly that. It is the reverse of sneezing, right? And so sneezing is a natural reflex that we do whenever something kind of irritates or tickles or triggers something in our nose, right? In our nasopharyngeal passage. And so that's a natural reaction. It's a natural reflex that we have to try to remove whatever it is that irritant is doing or whatever it is, right? Reverse sneezing is the same exact thing. It is a reflex for something. So if sneezing is a reflex for something in the nose or in the nasal passage, Reverse sneezing is a little bit further back than that, called the nasopharynx, which is
Mm-hmm.
basically where the nose meets the mouth, right? So all the way
Mm-hmm.
in the back of your mouth, like kind of right where those two meet, that's the nasopharynx. So when something is irritating or tickling that area, the reflex is a reverse sneeze. And that's the same thing as a normal sneeze, is just to try to remove that irritant or remove whatever it is irritating. It looks really scary,
It
because
sounds
it looks
horrible.
like they're having a hard time
Mm-hmm.
breathing, and it sounds terrible because they're making this weird noise.
Mm-hmm.
But it's the same idea as if they were just sneezing. And so if they do it once or twice, or have an episode or two or something like that where they do it, clear out whatever it is that's irritating them, cool, no big deal. It was just a reflex, fine. But just like sneezing, where, if they do it a few times or they have a couple episodes, you're not going to think much of it. But if they're repeatedly doing it, whether that's sneezing or reverse sneezing, that's when we start to wonder, could there be something pathological going on there? I would have people treat that the same way that they treat sneezing, where,
Okay.
if we sneeze a couple times, no big deal, right? But if
Mm-hmm.
you're repeatedly sneezing, or you notice that your
Sure.
pet, dog, cat, whatever, is continuously sneezing, that's a concern. Same idea with reverse sneezing, that if they do it a couple times or have a couple episodes, no big deal. But if they're repeatedly doing it, then that's a bit more concerning.
Okay. Diet. Best dog food. I know that's a very general term, but I know you have dogs, so I'm very curious to see what you do. But, we can go to Hollywood Feed and we can get everything from the whole food that's in the refrigerated case to the canned food to the
Mhm.
dry at Target or Walmart.
Mhm.
What would you consider the best?
So my opinion on that, I tend to be somebody, I like data, I like information,
Yes.
science things, that kind of stuff. That's how I kind of got into what I do.
Right.
So I like the foods that actually have some science behind them to back up their claims.
Mm-hmm.
So my opinion is the best foods are the ones that actually have studies behind them to support what they do, right?
I
And
totally
then I
agree.
think with that, we also at the same time have to have, in order to do those studies, you have to have the oversight of what actually goes in those foods.
Mm-hmm.
And so that's why I like the ones that actually have the studies and the science behind them. That being said, there are plenty of smaller companies, especially now that seems like there's dog food companies just kind of springing out of everywhere,
Mm-hmm.
that may not have the money or the resources or whatever to have all that science behind
Right.
them. From my side of things, I have a hard time making any sort of judgment on those, because I can't know. I don't know exactly what ingredients are in there necessarily. I don't know, if the food is going to do what it says it's going to do, or have the same results that it's supposed to. So it's harder for me to make those kind of recommendations with those specific smaller kinds of foods.
Mm-hmm.
I think the biggest thing, if I could tell everybody about this and just have the entire world know about it now, one of the trends that we've done in human medicine, where we're doing this grain, or not human medicine, but in human products, I guess, is grain free stuff, right? So that sort of stems from celiac disease or Crohn's disease, things like that, in people that they have some degree of I'm going to use the broad term allergy, but it's
Mm-hmm.
supposed to encompass any sort of immune mediated whatever. So people can have allergies to grain, in which case a grain free diet is fantastic for those people. Dogs are not people. So dogs tend not to have allergies actually to the grain or the carbohydrates in their food. And more commonly, it's to the proteins that are in there.
Mm-hmm.
And there's some good data that's come out in the last 5-6 years or so that are actually linking these grain-free diets to heart disease in dogs. And so what I'm going to say generally is, don't treat your dog like a small human. They still need to be treated like a dog, and dogs have different requirements than people do, and
Mm-hmm.
different ways of eating and metabolizing food to some degree than people do. And so the best thing for your dog is a good balanced dog food, not a human food or a human diet or a diet based on human studies, but treat them like a dog. They need well balanced dog foods.
Okay. And I'm so glad that you brought that up. I cringe when I see ads for grain free.
Yeah,
So, in your opinion, don't ever buy grain free.
correct. Correct.
Okay. That's right.
Unless your dog, for whatever reason, needs that particular kind of diet. Yeah,
Right.
absolutely. Dogs need the grain. It is something that should be in their diet. I also tend to, unless it's really done well, I get a little bit hesitant about the raw food diets as well. And I think if it's done correctly, it can be done well and they can be a good diet. But I think you just have to be very, very careful with it because any raw thing, again, is exactly that. So you still have to be careful about bacterial overgrowth and infections and things like that that can happen with those raw foods. I actually have this I have this argument with my dad all the time because he's sort of the mindset of, dogs have been eating junk for thousands of years
Yeah.
now
Yeah.
and they've survived just fine, right? And my argument is, people used to eat junk also. We would just eat whatever we could find, but also life expectancy for a human used to only be 20 or 30 years. And now
Right.
we're
Yeah.
looking to live
Yeah.
70, 80, 90 years. And
Yeah.
that's because of the advances in science and medicine and food and all that kind of stuff that we've made. So why not bring those same advances to our animals? And if we can improve the quality of nutrition and intake and stuff that they're getting, can probably also improve not only the quality but also the longevity of their life as well. So they
Wow.
don't need to be the foraging and hunting kind of thing that they used to be. They're not that anymore. So we can give them
Right.
well-balanced dog foods that might actually improve the quality of their life.
Could you just give us just a
Sure.
few, and I'll share these in the show notes and link to them
Yeah.
because people, they just want to know, we just want to know what's good. You don't want to stand in the aisle looking at dog food because it will drive you crazy
Yeah.
because you're just
Um,
reading marketing, you know?
I think the bigger ones that we tend to use in the veterinary field, we use Royal Canine. Hills is another easy one.
Hill, science.
Yeah, so usually the science diets are the ones that we tend to use in the veterinary hospitals and things like that. Those tend to be a little bit more of the well balanced, and they also are the ones that they make in prescription versions. So I think we're also just familiar with those. But Purina also, and there's different versions of the Purina ones, but I would generally say, stay away from their like lower line kind of stuff. It's just going to be less well formulated, some of the more byproduct-y kind of things. And then I don't have any stake in any of these companies.
Oh, sure. Sure.
But for my dogs, I have them on Iams, and that just tends to be, there is still a good amount of there's some better studies and stuff like that in Iams as well. Some of the veterinary practices don't view that as necessarily one of like the top ones.
Mm-hmm.
That's the sort of what mine ended up on because my little blind guy who I keep pointing at over here, and even though you guys can't see him, he's got a little bit of a sensitive stomach, and I sort of fell on this particular Iams diet that seems to be one that he does a lot better on, and so that's what my other two got as well because I don't like to feed them all different things.
Oh, yeah. Yeah.
They've been on that for 10, 11 years or so, I think now that they've been on this Iams diet and they've been doing just fine. So
Many dogs have a sensitive stomach. What would you recommend? Like one of these brands that said sensitive stomach or feeding them pumpkin or?
Honestly, I think the best suggestion that I can make is probably going to be a little bit of an annoying one, but from the medical science part of my brain is telling me to say if an animal is truly having these repeated episodes of having a sensitive stomach kind of thing, I think before we try to blanketly change their diet, I think it's reasonable, honestly, to talk to your vet. Is usually just the easiest thing. And if they think, cool, just try a different diet, that's perfectly fair. I will say, at least from my perspective, I think the general practice doctors probably have more experience with different diets than I do on the specialty side of things. So I would take their recommendations first. But I think if an animal is having, dog or cat or otherwise, is having these repeated episodes of GI issues, I think it's reasonable to at least reach out to your doctor and consider looking into things before we just blanketly kind of change their diet. There are lots and lots and lots of veterinary diets all based on sensitive stomach kind of things. But I think we need to first rule out that there's not some other more significant thing going on than just a dietary thing.
Supplements. Do you believe that that's advantageous for
Um,
dogs?
in terms of the supplements, I think some of them can reasonably help, but they're not going to be, at least in my opinion, fix for anything. I think they are still supplements, right? So they can maybe be a beneficial thing that we're adding, but we also still have to keep in mind we're still adding something, whether that's drugs or whatever. It's still a foreign thing kind of going into the body.
Mm-hmm.
And just like in human medicine, when we take different supplements, I think the biggest concern really is what's in there actually what's on the box?
Right.
It really is, both in human stuff and veterinary things in general, or in animal things, there isn't really a lot of oversight in terms of what goes into supplements. So I think in the right circumstances, supplements can absolutely be beneficial, but it's still something that we have to keep in mind. The ones that, don't have the science and the studies and stuff behind them so that we know exactly what they are, we just have to be careful a little bit about them.
Mm-hmm. Okay. Well, now I want to ask you this, Dr. Sender. What are the things that are dangerous to dogs that everyone may not know? I'm going to even ask you a few. Are grapes lethal?
Yes, they can be.
So keep grapes away from your dogs.
Mm-hmm. Yeah. So grapes and raisins are actually one of the more common toxins that we see in dogs. Doesn't really, as far as we can tell, seem to be a problem in cats. Mm-hmm. And this is a really, really good point of discussion, because there's been a lot of studies and stuff to try to figure out why grapes seem to be a problem, grapes and raisins. And we cannot seem to, for whatever reason, can't figure out what it is about the grapes, if it's like a metabolite, so something that they're turned into, or if it's the actual grapes themselves, or what part of the grape. But it seems to be a very, very significant problem in some dogs and not in others. And we don't know why. But the bottom line is that they can, and we need to be very careful, but they can cause kidney failure, or at least kidney damage. So grapes and raisins, absolutely not to any dogs at all, because we just don't know which ones are going to have that problem and which ones aren't. So no grapes or raisins for dogs.
Okay. Chocolate. I know that's a spectrum.
Yep. So chocolate also is really bad for dogs for multiple reasons.
The darker, the worse. And the more they've consumed, the worse.
Yeah. So the darker the chocolate, it has what's called methylxanthines and caffeine. Oftentimes, caffeine is actually an example of a methylxanthine. Those will actually cause an increase in heart rate, as well as some heart arrhythmias or abnormal rhythms. And in really, really high doses can actually cause seizures in dogs. Mm-hmm. Generally speaking, in lower doses, it just tends to cause a little bit of GI upset. So they get some vomiting, diarrhea, and that kind of stuff. But when you get into higher doses, what we worry about is heart or cardiac kind of stuff, as well as neurologic or seizure kind of problems.
So call poison control with the amount.
Yep,
okay.
Yep.
Xylitol, sugarless gum.
Yeah, so xylitol is kind of a sugar supplement. It's a sugar alcohol, right? And what we see in dogs and cats, actually, cats tend to eat it a little bit less, but it can actually cause two different disease processes. One is it mimics sugar. And so the body in the dog thinks that it just got a whole bunch of sugar. So they also release a whole bunch of insulin, which is, I'm sure everybody kind of knows a little bit, but insulin kind of gets the sugar, into the cells where it needs to be, rather than just floating around in the blood. But if you have this non-metabolizable sugar-like product like xylitol, that's not actually sugar and isn't going to do the same things as sugar, and then you also get this huge insulin release, these animals can actually get low blood sugar from that. And then they can get that sign secondary to that. So they get weakness and collapse, and they can even get seizures from that as well. So that's one of the processes that happens with xylitol. The second one is that it can also directly cause some very, very significant liver damage. And some animals can actually go into We call it fulminant hepatic failure, which is basically just full-blown liver failure from xylitol because it directly injures those liver cells, basically. And so xylitol is definitely something to keep away. Really, any sort of sugar supplement is something that we need to keep away from dogs because not all of them will cause the same reaction, but they can all be risky to some degree and not something that dogs need. Honestly, humans are much more tolerant of that stuff than dogs are.
Are there any other foods or things that people may commonly keep at home that need to be kept away from dogs besides grapes, raisins, chocolate, xylitol?
For dogs, I think the other big things, if we're just talking about in foods, I think the other one to keep in mind is onions and garlic. Yeah. So most people
Cooked, uncooked, or does it matter? Raw,
it
cooked,
doesn't matter. Doesn't matter.
Onion and garlic.
Onions and garlic. And really what's even worse than those things are the powder versions. So if you have like onion powder or garlic powder, and I'll tell you a really interesting story is
wow.
We actually had a case at Auburn of a dog that was I'm not gonna rat out the company, but was getting chicken nuggets from a particular fast food store. There's a bunch of different kinds. They use garlic powder on their chicken nuggets, and this dog was getting chicken nuggets every day, and ended up getting the side effects of garlic. And onions and garlic actually do the same kind of thing, but basically what it'll do in dogs is it causes damage to their red blood cells. So they will get a low red blood cell count, or something we call an anemia. And that obviously is not good for them. So onions and garlic, and generally speaking, in like the volumes that we use with like fresh cooked kind of stuff, is unlikely to cause any real significant issues aside from some GI upset. But it's still something that we need people to be aware of. To honestly, they just should not give their dogs onions or garlic.
Which would come by giving them food that you cook, table food. So that's one reason table food is not good. Anything else?
I think that's
okay. Tell me what level of, a lot of people have the people that come and spray outside for mosquitoes. And then occasionally bug spray, exterminator. To what degree should you worry about that? Or do you think most of that is all sorted out by companies that don't want to get in trouble?
So I think generally speaking, I would say the risk is low. It is still there, but it's low risk. And most of the pesticides and things like that we use now, while they're toxic in large amounts, in small amounts, not really, a significant thing. What we used to use, or what some people actually still have like on their farms and things like that, is what's called organophosphates, which are pesticides basically. And some of the older ones are more toxic than the newer ones. The biggest thing for everybody to keep in mind is, while it's hard not to question what that is, again, I think the risk of that really being a problem is very low. Most of the time, once those products are, when they're sprayed, once they dry, they're no longer toxic. So if you have your lawn sprayed or whatever, just make sure that your dog, cat, whatever, isn't going out there until it had a chance to dry. And once it's dry, even if they eat the grass, it, again, might cause a little bit of stomach upset or something like that, but not really going to have the toxic problems that we worry about if they were getting more significant exposure.
But rat poison is always bad, correct? I mean, isn't that pretty much that's bad news?
Yeah. So rat poison, there's a few different kinds of it. So we have the anticoagulant ones, which are some of the older generation rat poisons, which basically just cause animals, and the way that the mice die from it is that they actually bleed out. So they inhibit some of the coagulation factors that we use to make blood clots and things like that. So if they inhibit that, you can't make blood clots, you end up bleeding. So those are some of the older ones. I believe we are now phasing out those anticoagulant rodenticides. And so the other ones that we have available to us are actually a lot worse than those. Yeah, I know it sounds weird, but the other one that we have is brodifacoum or bromethylin, is more. So bromethylin, it's a much more complicated mechanism that it works by. But the anticoagulant ones, the ones that make you bleed, at least have an antidote to some degree. The bromethylene ones don't. So if an animal gets exposed to that, and to be fair, they have to get a pretty large amount in order to make it cause a problem, but it is reasonable. And I've seen it, unfortunately, in some animals that have eaten a lot of it, but it's irreversible. And generally, it's a pretty poor prognosis. So we have to be really, really careful with those. And then the last one that we have that also is still available is actually our calcium analogs. So the way that those work is actually they just make you absorb a lot of calcium from your GI tract, and then you start to mineralize things that you shouldn't mineralize.
Ooh.
And that's also a pretty unpleasant way to go.
And these are both rat poisons.
All three of those are rat poisons.
So that if you go to Home Depot or Lowe's, those are going to be the most prominent ones.
Yep. So we have the anticoagulant ones, we have the bromethylene ones, which are neurotoxins, and then we have the calcium analogs as well. Mm-hmm. And so there's three different kinds, and I think the biggest thing for people to know is that we treat them very, very differently. Most important.
So know what it is. If you
know exactly which one you have,
take a picture of the box.
Exactly. And call poison control if you think your animal got it.
Okay. Now, and I'm going to throw one out. If you have a household of females, tampons, hide those. And I think washcloths, underwear, that's bad, isn't it? You have a limited amount of time. I mean, how many tampons or small washcloths could kill a dog?
It only takes one. Yeah. So I'm not going to say every single time if your animal eats a little bit of a cloth, they're going to die, because obviously that doesn't happen. But the risk is that cloth can get stuck in the intestines, whether it causes an actual clog to the tube, or if it just kind of gets looped in there a bunch, basically. Any time that they ingest something like that, it could cause that kind of problem. And it's possible that they'll be able to pass it, but it's also just as possible that they won't be able to. And therefore that becomes an actual emergent situation. So that's why I say it only takes the one, because they might be able to pass 10 before that. But if
right.
For whatever reason, dogs love to eat underwear and tampons. And
And now I want to ask you this. I did this, I believe, on 2 occasions. I poured hydrogen peroxide just down his throat do you advise that to make them throw up?
The biggest concern, like you were just getting at, I think, is if it's gone past the stomach, or if it's stuck kind of at the exit of the stomach going into the small intestines, and then we make them vomit, we could just make things worse. So if it's just in the stomach and we make them vomit, it's possible that we can get lucky and it just kind of comes out on its own. Thought process is, if it was able to go in, it should be able to come out, right? My personal opinion on this is, I know poison control will still sometimes recommend hydrogen peroxide, and there is a dose. I think we need to know that dose so that we don't give them too much or even too little. Hydrogen peroxide works to make an animal vomit, honestly, by causing direct irritation to the stomach. Mm-hmm. And so if we do that, we have to know that we're also going to cause, honestly, some actual damage to the stomach itself. And so it's not the most pleasant way to vomit. When you take a dog to the hospital, or a cat even, we actually have specific medications that work in the brain to make them feel nauseated so that they vomit that way. So it doesn't cause
that irritation.
Stomach irritation, exactly. So it's still going to cause a little bit of irritation when the vomit comes up. It's going to irritate the esophagus and that kind of thing, but it doesn't actually cause irritation to the stomach itself. So my personal opinion is not to do hydrogen peroxide, because it does damage the esophagus. It damages the stomach. It can also cause some derangements in their pH, their blood pH, as well as some of the electrolytes. And so we just have to be a little bit careful about it. If there's an emergency situation, or if you just cannot get to a vet hospital, or if they're closed, or whatever it is, that's the appropriate time to use it. But my personal preference would be, if you think that your animal ate something, take it to the hospital and have them make the animal vomit there.
But I just want to ask you, and I see your three are different sizes. You've got a good little menagerie. But my friend who has had a standard golden doodle and a small one, we had this conversation and I said, I'm going to ask Dr. Cinder because he can probably answer this. We think that big dogs, and specifically we've had golden doodles, are more like people. They think like people, they act like people, and little dogs are just a little bit oblivious and not as smart. Now, I don't want to get emails or hate mail from people because I've had little dogs before, but what do you think about that? Even breed wise, size or breed.
I think, I've always been a huge proponent of mutts. That's sort of what I have in my house.
Yeah.
But I will say, just like us as in people, like all dogs, all cats are going to have their own personalities. Now, there are definitely some breeds that are more predictable than like mutts and things like that. Like, if you buy a golden retriever, you pretty much know exactly what you're going to get. Or if you buy a lab, you know what you're going to get, right? And so each breed to some degree has its own personality traits that they are more likely to express. But every animal is still an individual. And even though you buy, if golden retrievers are known for being these big, dopey, derpy kind of animals, you might still get one that's a bit more reserved or quiet. Breed specific stuff is a little bit more predictable, but there's still individual variation in there. In terms of are larger dogs smarter or more people-like than smaller dogs? I guess I would maybe, I don't know. I would have to argue a little
No,
bit.
you don't want to open a can of worms. I know. I'm afraid too, because all the small dog owners will rise up.
I think it depends. I think whatever animal you get, you should know what you're getting into, right? So you can't expect a miniature pinscher to behave like a Great Dane, or if we're going to compare sizes, like you can't even expect like a terrier to behave like a Chihuahua. Like they're not going to be the same thing, right? So I can tell you from my little menagerie here, my little terrier definitely has some small dog tendencies, but I find she, in a lot of ways, behaves more like a big dog. So to me, she's always kind of been like a big dog in a small dog body. Actually, a good example that we talk about in the veterinary side of things all the time is greyhounds are real big dogs, but they behave more like little dogs do.
Yeah.
And they're these super duper lanky big creatures that honestly take up a lot of space, but they don't think that they do. And they just like to lay around, even though they're built for running. They would rather just like lay on the couch. I've also seen plenty of real big like Great Danes and things like that want to be able to sit on your lap on the couch, and they have no idea that they're 120 pounds.
Right.
And you have this 15-pound thing who thinks that she's 150. So
oh my God. Well, I know, and I do want to ask you this, and you have three. People say get at least two, because then the dogs will have each other. And I had probably an unhealthy relationship with Cam. He was always with me, always with me. Do you agree that it's better psychologically for them to have their own kind, at least one?
Not necessarily. I think I can't even say the same for cats, honestly.
So you don't have three for them. You have three for you because you want three dogs.
I will say, like, honestly, if I could ask all three of them, I think my pit bull would love to have like 6 more.
Yeah.
She loves dogs. She loves to be around other dogs. Yeah. Jake, my blind guy, is kind of okay with whatever, as long as he has his like area that he can just kind of like go and be on his own when he wants to. But he doesn't mind being around other dogs and interacting with them and that kind of thing. If I could ask my little terrier Scout, she would say she should be the only dog in the house always and forever. And it would just be me and her, because we probably also have a little bit of an unhealthy relationship, but she is very like, her focus is always on me and what I'm doing. And not that she doesn't get along with other dogs, she just really does not care for them at all. Like, doesn't want to interact with them very much, would much rather be interacting with me. I can also tell you when I was growing up, convinced my mother to finally get a dog when I was 16. He had a Cavalier King Charles Spaniel, and he 100% thought that he was a person and wanted absolutely nothing to do with those other four-legged creatures that were far beneath him.
Oh, that's so
um,
funny.
so he would not have done well with any other animals in the house. He very much wanted people. That was always his focus. And so I don't want to say necessarily with everything that it's going to be an individual kind of one-on-one sort of basis sort of thing. But I think to some degree, we do need to kind of read our animals a little bit. And the good thing is they're still dogs and they can adjust to almost anything.
Right.
They're learning and teachable kind of creatures. And so I don't think that any animal necessarily has to have another one of its species to be happy.
Last one. What thing do you see frequently that you think, I wish I could shout this from the rooftop to dog owners, because so many intelligent people who love their animals obviously don't know blank?
Yeah. I will say from my specific side of things, from the emergency and critical care side, most preventable things are those real big, like blunt trauma kind of things, the ones that get hit by a car or get run over by something. And that's just because they're left to roam around and do whatever. I think if you keep your animal within a specific area or keep them on leash or whatever, that's a very easy preventable thing that I would love to not see so many trauma cases. Like
Yeah.
it's just, I feel like to me, most of the time, those are very preventable. If I were to speak from the veterinary community in general, is similar kind of preventable medicine stuff. So flea and tick and heartworm kind of things. Here we have lots of mosquitoes. So heartworm is everywhere all of the time. That's how it's transmitted, is by mosquitoes. And it's really, really easy to keep your animal on heartworm prevention. I mean, you just need to take them to the doctor's office once a year. You can get a year's supply of heartworm medication and keep them on that. And honestly, that is almost 100% preventable if we keep them on the preventative medicine in that sense. Similar thing with flea and tick disease. Fleas don't transmit as much disease, but ticks do. It's a really, really easy thing to just keep them on tick prevention. And we can just avoid all of the infections and things like that ticks cause in general. So I think if we just use those preventatives that are available, we would have a lot less disease in that sense.
Well, that is very, very helpful, and have a good relationship with your vet.
Absolutely.
Dr. Sender, thank you. You've offered a lot of practical and helpful information to everyone. I'm so grateful that you've spent this much time helping us out.
Thank you for having me. I appreciate it. It's nice to talk to you again.